Cormier.
Thank you, Madam Chair. And I have a question around capacity and quality. We're hearing a lot about the need for both. Can you tell us, what would you say to individuals who tell us that privately delivered childcare is the best way to address challenges to access, especially in rural and remote settings? And to comment further on what are some of the best practices that you've seen in different jurisdictions that you think the federal government should be scaling up as a national norm? So I'll start with, how about you, Ms. Friendly? And then Ms. Ballantyne.
Could you just clarify, Senator Moody, what you mean by that?
So there is an argument that with the significant capacity restrictions, that privately delivered care is the best way to address the challenges to access, especially in rural and remote settings. What would your response to that viewpoint be?
I would say that all the evidence shows that it is not necessary and not so. I mean, if you mean privately delivered, you could mean an individual woman caregiver in her own home, not with public oversight, or you could mean a for-profit center. And I would argue that neither of them is the right solution. And I would say that we have really good examples in rural and remote communities when there is actually the will to put a program there and the will to fund the program so it can function. It is what functions the best. We can see that across Canada. I think that people in rural communities need the public oversight. I don't think that for-profit childcare, if that's what you mean, is the right solution, and it's not going to move into, I don't think it's the right solution anywhere. And I think that the barriers have been that about population density in rural communities, they did not they could not make a budget to deliver a child care center, a nonprofit or public child care center, previously when it wasn't publicly funded. Now that it's publicly funded, it's going to take public leadership in expanding child care to communities that are child care deserts, so that we can begin to be more equitable in the way that they're distributed. So we have examples of good quality small child care centers in rural communities, but only if there has been enough public funding to allow them to function. So I think that this is a matter of public leadership, public management, and political will to make sure that we're going to have an equitably distributed supply of childcare, if that answers your question. People in rural communities and children in rural communities also need good quality childcare with other children in groups, not for profit, in the same way that people in cities do.
Thank you. Thank you. Ms. Ballantyne?
Very quickly, I would say that if it was the case that reliance on private provision and supply would answer the problem of access and equitable access, then we would have an accessible, equitable system. We don't. That, in fact, what we've relied on in this country for decades now is private delivery, either on a for-profit or a not-for-profit basis. Essentially, we've relied on individuals or organizations to kind of hold up their hand and said, yes, we will provide childcare, we will make it happen. If we did that with healthcare, if we did that with public education, there would be a massive outcry, because wealthier communities would have more, wealthier families would have more, and that's essentially what we have with childcare. And so it's the wrong solution. We've tried it; it's failed. Every country that has tried it has failed. The only way is a publicly managed system.
Senator Cormier, your 4 minutes.
Merci, Madame la Présidente. D'abord,
Senator Moody, the sponsor of the bill.
Thank you, Madam Chair. My question is around regulation and licensure. We know that regulation and licensure is currently written in at the level of the agreements, for all the agreements. In your opinion, and this is to all of you, considering the concern about federal legislation intervening into provincial jurisdiction, is it essential that this requirement for regulation and licensure be included in this legislation? in your opinion? And a definition.
I can speak to that. Thank you, Senator. Absolutely. I mean, I think it protects the investment of public dollars when it's going into a quality system. I believe if that were to be taken out, it would be actually taking a backward step for Canada, seeing that all agreements were signed on that notion of licensed and regulated care. And I believe the research, and you've heard this today and yesterday, it's focuses on fair wages and compensation for educators. It's more affordable for families, and it's a better outcome for all. So it's really a win-win, and it's a really protected investment when you know what the funding is going into.
Bertrand?
I'm sorry, I didn't understand the question. I apologize. The question was...
So right now, we've heard many times that regulation and the need for licensed childcare is already written in at the level of the agreements with each province. But we've heard that it should be elevated to be included in the legislation. In your view, is this an essential piece of what needs to happen here?
Ms. Bertrand, would you take your mic and put it closer to your mouth, please? We are having trouble, and the translators are having trouble.
Okay,
Okay,
my
that's
apologies.
much better. Thank you.
Okay, my apologies, it slipped up. Well, as I've said in my remarks, we want to also align with public education. Now, public education can license young programs for younger children and hold licensing and regulation. That is all part of what alignment with public education mean. Yes, regulation is important, licensing is important, and needs to be part of a publicly managed system.
I'm sorry we can't hear Ms. Kale on that, but that is an important question. Hopefully we can explore it further. Perhaps Ms. Kale would respond to us in writing. Colleagues, all of a sudden, I go from famine to feast. We have time. So, please, yes, we have time and not too many senators asking questions. Senator Courtney.
Thank you, Madam Chair. And I just wanted to make a few points and then ask my question. So I think it's important that, yes, based on the current data and availability, we don't have enough spaces. That's not something we would contest. That is why we're building the system. That is why we're building it this way, and I have some trouble with the assertions that the system is broken when it has not yet been built. Second, we do provide support for children and families in Canada. The Canada Child Benefit does that. It provides hundreds of dollars in support to families for many things, including childcare. Third, the fact that childcare businesses are dying because they're not making enough money is exactly the issue. We don't want the bottom line of childcare providers to be the difference between someone having childcare or not. Access should be built, I believe, on the needs and aligned with public leaders who are building communities. This is not really about choice. No one is forced to use public or not-for-profit childcare, just like you're not forced to use private versus public education. If they want to continue to use for-profit at higher fees, families are welcome to. I think the arguments around parental choice are also a bit, frankly, red herrings, because I haven't really heard any data, and I'd offer the question to you, please, can you provide that data about parental actual choices, what they would want to do, but I'm hearing about the choices they're forced to make because of the lack of availability of public care.
Question 4.
So the question is for anyone to comment, really, on the inherent policy choice in this bill. Canada will build low-cost, accessible, and affordable childcare for every family. It will take work, it will take money, and it will certainly take time, and we're heading there. and I want to get your thoughts on some of the comments that I have made. I appreciate your testimony and thank you for your service in this area to all of you. So
I'm happy to jump in if I can provide a little bit of an answer to that, I guess. I believe in the system. I think that the intention of the Seawell program is amazing, and as a mother of 2 children who have used childcare in the past and paid for it, I think having affordable childcare options is such a massive relief and support to Canadian families. I don't believe that small childcare businesses are dying because of lack of profit. What is happening is that lack of access for families in those programs to access the affordability grants, lack of wage top-ups in those programs, lack of subsidy for families in those programs because their business model does not allow them to access the Seawell program. That is what's hurting businesses. That's what's devaluing these small businesses. The large for-profit childcare centers that there is concern about, those centers are massive business-minded corporations. And if you look at what is actually happening on the ground right now in Alberta and other provinces, those centers are pivoting their business model to a non-for-profit business model. So when you're celebrating the creation of new non-for-profit spaces under this program, are we looking at where those spaces are coming from and who's actually creating them? So if there's a concern about public funds funding private business, there needs to be some studies, some reviews done of where things are pivoting here, because we're not celebrating the number of new private or new non-for-profit spaces that we think we are in our province. I think that the system isn't broken, but I think it was rolled out without understanding the sector. I work on the ground. I'm not behind a desk researching this. I am on the ground and I'm experiencing what families are experiencing, what children are experiencing under this program. And it was rolled out without consideration to the demand it would create. It has created a significant demand without the infrastructure provincially to support it. So we are losing inclusive funding in our centers, all centers. There is not enough funding or support to support the high needs of the children that we're seeing, which is creating a burnout in the ECE sector. We are losing quality because people just don't have the funds. We've been under a fee cap under this program in Alberta. We have not been able to raise fees across the board, nonprofit or private, to match inflationary
Chair, I'm
levels.
afraid I have to cut you off. Senator
Sorry.
Cormier, Senator Petitclerc, do you want to quickly restate your question? Or you will...
Thank you, Madam Chair. And Ms. Golick, it's really good to see you again. We met when I was in BC earlier this summer. And I'd like to direct this question to you. One of the benefits of developing a national program is that different jurisdictions can learn from one another. You are from BC, and there are a number of best practices that could be identified coming out of BC, like we heard about earlier from another witness on PEI. I'm wondering if you could share with us some of the best practices that you have seen in your jurisdiction or others that you think the federal government could play a role in setting up as a national norm, especially as it relates to establishing a sustainable, high-quality workforce.
Nice to see you too, Senator Moody. I think that one of the things that has been transformational, I think, for BC has been the recruitment and retention strategy that the BC government has implemented. Obviously, there's lots of ways that we can strengthen and move forward, but having funding that directly supports the sector itself, whether it's been with wage enhancements, with student bursaries, but also extending that professional training and development as well for more seasoned educators. There's a peer mentoring program that has had great success in connecting newer educators to longstanding educators. The Pedagogy Network, which has really been able to highlight the pedagogy of early care and learning to really, for those educators to see themselves as the strong professionals there are. there's multiple initiatives, and I just think we need to build that into a sustainable system so they're guaranteed for years to come.
Thank you. I'd welcome comments from Ms. Mullen and Ms. Beasley if you had anything to add.
I think, thank you. I do believe that we do learn from other provinces, and we do see some wins and some positive changes. Certainly, regulated family home daycare is such an important part of this whole process. I come from a rural area. I sympathize with the folks in New Brunswick because I come from a French region myself. So in order to have culturally available childcare in these rural areas and across Nova Scotia, I know we have many. So we need to regulate them. They provide quality childcare. And while private childcare exists, and it's not always that families can make that safe choice. Having regulated childcare, whether it's in a family home or if it's in a center, families need to know that the opportunity they have for paying for childcare and accessing childcare is safe. And in order to do that, as a licensing officer, it has to be regulated.
Thank you. Senator Cormier, followed by Senator May.
Thank you.
Thank you, Madam Chair, and thank you to the witnesses for being here today. I would like to take an approach that I've taken before, which is to focus on the benefits and the learnings of developing a national program across jurisdictions, where one jurisdiction can learn from the other, and particularly with your experience around Quebec. I'd like to know what you could share with us on developing a sustainable early childhood workforce. What are some of the lessons learned from Quebec's perspective in terms of how to do this, what were the missed opportunities, and what you've put in place that could be shared across jurisdictions? And Madame Gosselin, if you would start, and then anyone else, perhaps.
Oui, merci. Merci. Je ne suis pas certaine d'avoir bien compris la question. Je crois qu'il est question de la formation des éducatrices, les occasions ratées, ou qu'est-ce qui est... je ne suis pas sûre d'avoir bien compris la question.
So I'm sure in your experience you can identify areas that you feel were areas you had to focus on, there were gaps, and perhaps you have developed in Quebec some best practices that you would share with us about how you address some of the issues you faced. Particularly as it references to the workforce and developing a quality workforce that's trained properly, that has appropriate wages, and that has good working conditions.
Parfait, merci. Oui, je comprends très bien. Donc, au niveau de la au niveau de l'expérience du Québec, pour œuvrer dans les centres de la petite enfance, principalement, ce qui est reconnu, c'est le diplôme de niveau collégial, donc une technique en éducation à l'enfance, technique en éducation à l'enfance. Et ces personnes-là, techniciennes, qui interviennent, qui œuvrent dans nos milieux, sont donc hautement qualifiées pour intervenir auprès des jeunes enfants et aussi pour pouvoir dépister les besoins, certains besoins plus spécifiques au niveau du développement des enfants. Avec la pénurie de main-d'œuvre actuelle qu'on connaît, et aussi avec le manque de reconnaissance du travail essentiel qu'occupent les éducatrices en petite enfance, bien, il y a très peu maintenant de personnes qui se dirigent vers les études collégiales en éducation à l'enfance. Alors, premièrement, au Québec, d'avoir développé cette technique qui forme des spécialistes dans le développement de la petite enfance, c'est un très bon coup, c'est extraordinaire. Par contre, le manque de reconnaissance salariale, professionnelle de ces travailleuses-là fait qu'il y a très peu maintenant de personnes qui se dirigent pour faire la qualification, pour faire les études de niveau collégial. Donc, ce qu'il faut, puis ça, c'est une lacune. Il y a eu un rattrapage effectué par le gouvernement du Québec dernièrement, aux dernières négociations, pour rehausser le salaire du personnel éducateur, mais ça arrive tardivement dans notre développement parce que la politique familiale a plus de 25 ans, ce qui fait que là, il y a vraiment un retard à rattraper, tant au niveau de la reconnaissance que d'inciter des gens à venir étudier dans ce domaine-là extraordinaire pour pouvoir pallier à la pénurie de main-d'œuvre qui est quand même majeure dans notre secteur, qui est un secteur, il faut le rappeler, principalement de femmes. Je pense que c'est 97 ou 98% de femmes qui sont techniciennes en éducation à l'enfance. Donc, quand on dit femmes, on dit évidemment manque d'équité salariale, manque de... Donc, c'est ça. Donc, les occasions ratées, c'est d'avoir une meilleure reconnaissance plus rapidement pour éviter un désengagement des étudiants vers ce secteur d'études-là. J'espère que je réponds bien à votre question.
Thank you very much, Ms. Goslin. Senator Pettycliffe. Thank you. Senator Moody, followed by Senator Cormier.
Thank you, Madam Chair, and thank you to all witnesses today. I wanted to refer to an earlier comment about the discussion in the House on this matter. So there was significant discussion in the House given to the opportunity to amend Section 8, and they didn't. In fact, no members brought it forward. There was significant discussion about education for official language minority communities and recognition that it's essential to protect from assimilation, to preserve culture. And I think we're all very supportive of that here. That's what Section 7 is about. It deals with the criteria for funding, and it makes clear that those communities must be included and that this must be reflected in all the agreements. Whereas Section 8 is about something different. Section 8 is about the mechanisms, the pathways by which money is distributed through agreements with provinces, through agreements with territories, and through agreements with Indigenous governments, existing pathways for mechanisms of distribution of funding. I also want to point out that when asked about altering Section 8, I asked the question of the government, and including in an amended bill a new pathway for funding directly to communities, which is not the policy intent of this bill. I was told, and I'll give it to you straight, that the Government of Canada already has long-standing funding relationships with the provinces, funding relationships with the territories, and with Indigenous bodies that are their pathways for distributing money. That there are concerns, frankly, about negatively impacting these relationships, especially with Indigenous people, by adding new funding commitments, new pathways to official language communities, to any particular community, and not recognized as a funding pathway, but a community, as the established partners or funding mechanisms will be the way that money is distributed to provinces, to territories, and to Indigenous communities to provide ELCC services within their jurisdictions. So my question to all of you, each of you, is, what would your response to this be? It's about a mechanism for funding. It is not about omitting a group.
We have institutions that we've fought long and hard to create. The one that comes best of mind that alludes to the question you've asked, Senator Moody, is our Francophone school boards, which were created, which are the only para-public institutions other than our municipalities and certain provinces, that we fully control. School boards are obligated under provincial law to adhere to all of the financial obligations and the corrective measures that their respective auditor generals will do in due course. So in terms of a pathway, that would be a parapublic entity to a government entity. In terms of francophone communities, are probably the most easiest way to adhere and create a pathway that would be acceptable, as opposed to putting a situation in, putting a system in where not-for-profit organizations or others would be responsible for that level of engagement. So I think there are existing institutions and pathways that exist, and I've always believed, and I've been in front of many committees over the last many years, and I've always brought the same point. I think time has come at the federal government enable direct conversations between the federal government and minority language institutions, in particular, in this case, school boards. And then school boards, with their own behest, could create structures and put the mechanisms in place to their delivery agencies, and it would be one level of government less. And I think in terms of being able to have direct access to where the rubber hits the road, I think it would be a very interesting corrective measure. So yes.
Anyone else want to comment?
You actually don't have time, but I'll allow anyone else to comment. I'm not sure I heard a direct answer to your question, so maybe we can get it from others. Professor Larocque. Mr. Racine.
Oui, peut-être juste pour être très, très clair, on ne demande pas un nouveau mécanisme de financement. Nous, on veut juste s'assurer que dans le cadre des ententes fédérales provinciales, on tienne compte des besoins des communautés francophones en situation minoritaire. Donc, on comprend très bien qu'il y a deux mécanismes de financement. C'est juste que dans le mécanisme qui touche les provinces et territoires, ça soit très clair qu'on doit tenir compte des besoins des francophones. Et que ça ne soit pas juste au niveau des principes, mais au niveau de l'engagement financier.
Si en permet, j'aimerais renchérir. L'article 8, par ailleurs, spécifie que le financement est transmis dans le cadre d'entente entre le fédéral et les provinces et les territoires, pas directement aux communautés. Et ce n'est pas ce qui est demandé et reflété dans les amendements suggérés. Donc, ce n'est pas un nouveau mécanisme qui est proposé ici, mais tout simplement, comme le suggère mon collègue, la prise en compte des droits linguistiques des communautés de langues officielles en situation minoritaire, dans l'engagement ferme et à long terme d'inclure ce.
Thank you, Professor. That's interesting testimony, actually. The sponsor of the bill, Senator Moody, has a final question, and I'm going to allow her 3 minutes, and we will eat into our next panel. But
so I just wanted to rehash some of the information that I'm aware of and ask you for comment. 2018, the Assembly of First Nations, the ITK, the Métis governments all collaborated with the government to co-endorse an Indigenous early learning and childcare framework. Through this, vision, principle, and objectives were determined, and through the distinctions-based national partnership tables on ELCC that were developed with these groups, these partnership tables included ELCC experts, program administrators, regional and community technicians, all mandated by their leadership to participate in this forum and to develop this program. These national tables develop policy and priorities. They co-develop the framework. So I'll run forward a bit to talk about. I just talk about what I've learned about the 50 Indigenous government partners that were consulted on this legislation, and I'm wondering whether this information is correct. And it reflects your understanding of the participation that perhaps your group and others were part of.
Please,
Would you like
Mr.
me to speak?
We'll go around the room for this answer, and then we have to stop.
Yes. For ITK, the framework in our mind, or in our position, is it was co-developed. And that is a very distinct difference from this legislative piece, but we participated with government on talking about the provisions within this piece of legislation.
Thank you. Let's go to Ms. Omenyo first.
With the Métis Nation, it's very much like ITK. We have an IELCC table. Everything you said was exactly what we're doing. And we have been engaged, maybe not specifically around co-development around this legislation, but we have been engaged in having input into these things. And we continue to do that through our permanent bilateral mechanisms. So our governments have been involved to some level.
And finally, Interim National Chief Bernard.
Yes, I believe that we've also been part of the framework, but we have not been part of the legislation and co-developing the legislation. The legislation, I believe, was developed and then submitted and then asked questions later. So that's where the problem lies. As I mentioned before, it should be from the beginning of the creation of the legislation. And the framework helps, definitely, but it's not. That's not consultation, and that's not prior consent.
Thank you so much. We leave this hour with you infinitely better. Colleagues? Senator Moody.
So I'm just wondering if, in just thinking about ongoing consultation around the building of a childcare system, I'm wondering what your thoughts are about the existing partnership tables that the Government of Canada has with all three groups, in which they continue to have dialogue about a number of things, including childcare. And they have also raised concern about not seeing this overturned. I'm using my own language there, or in any way diminished. But that strong relationship and dialogue exists. So I'm wondering what your thought is about that. Their concern specifically was around the National Council in some way interfering with that.
I would defer to Ms. Bono on that.
No, it would be for you, because
For me.
You comment specifically about this.
I don't know that I can that I have any background in which I could comment on the existing interactions between the various governing levels on other aspects of other programs. Really, the mandate that I would have here today was to comment on Bill C-35. Forgive me, I don't have any in-depth knowledge with respect to any government interaction with any other groups on other pieces of legislation.
I'm guessing the question was, their concern is that the existing opportunity they have for dialogue in their partnership tables not be in any way interfered with by the National Council. And so with that caution, I'm wondering about trying to develop, trying to ensure that there's a parallel system of communication is what this potentially could be.
Forgive me, Senator Moody, I'd have to take that back to the working group. I don't have any information on that.
Okay, thanks.
Senator Corman.
Okay,
Senator Moody.
Thank you very much, Madam Chair, and thank you to the witnesses. I wanted to just think back, if I could, with Ms. Carr, about your experience with HUMA. I know that you did provide a brief that very much, very closely mirrors what you've said today. And I know that it was considered and discussed, and that in fact probably did result in the strengthening of the bill around disabilities in 71C. I'll just read it very quickly. support the provision, including in rural and remote communities, of early learning and childcare programs and services that are inclusive of children from systemically marginalized groups, including children with disabilities. And it goes on. So I'm wondering what your thought about why specifically further explicit language is needed. What was not provided by that amendment, which I think the folks in the other place thought had addressed your questions and your concerns?
So thank you for the question, Senator Moody. First of all, I'd want to say that we worked really hard to try to present to HUMA, and we're not able to get on that agenda. So I appreciate the opportunity to present to you. I think we feel like it doesn't go far enough. That particular section that you're specifying needs to also include that it isn't just about saying you're inclusive of children with disabilities, but that you're actually providing the necessary supports that are required to ensure equal opportunity and equitable access. That's the piece we're looking for. So definitely appreciative of the fact that HUMA added in disability and appreciative of that, but we're asking for it to go a bit further in terms of ensuring that the necessary supports are provided for that to be successful and for that child to be able to thrive in that environment.
For Ms. Lanahan, I'm wondering, there's been some discussion, and you raised it yourself today, on the around the definition of ELCC. While some are seeking a stricter definition, others have highlighted, I think you included, that the need to have a flexible definition to keep it open is more inclusive. We've also heard that a stricter definition could tie the hands of the government and of provincial governments and territories moving forward if they wanted to expand the program. Could I hear your thoughts on this? Community.
Sure.
Is a more flexible definition better for children with complex needs?
I believe it is. I believe we need flexible systems, and so legislation that of course, we want it to have strict parameters in terms of ensuring inclusion. Opportunities are there, but the flexibility, I mean, our kids need the utmost in flexibility in the sense as I described. They don't reach those milestones of independence at 12. So if the decision is made to expand and put a definition to 12, then we are explicitly excluding kids 13 to 19 who are not able to have their child care or their care support needs met. So I think, I just believe that it's important to understand that if any definitions are provided. I just really think that we need to ensure a flexible system. There's many kids that need different opportunities, like I suggested as well. Sometimes in those older years, direct funding so that a family can be empowered to hire a support worker so that after school, that child has the support they need, maybe to attend an after school program or to get home, something that's flexible, that works. The really unique needs our kids have, everything from medical support to behavioral supports that are very different needs as well.
Thank you, Ms. Lanahan. Senator Cormier. Senator Moody.
Thank you, Madam Chair. I'd like to carry this discussion about what your data tells us and extrapolate it a little bit to what we're hearing. So your focus on Section 5 of your report, where you talk about your findings on the gap between nonprofit and for-profit fees, particularly Figure 7 demonstrates notable gaps. And when we consider that the for-profit sit much higher and generally seem to be much more costly to run for whatever reason, we often have engaged and heard in this committee that for-profit expansion is a solution for lack of access in certain communities. I'm wondering, given that the higher fees that centers, for-profit centers are charging. In your view, what would the impact be for expanding for-profit childcare in areas where there are childcare deserts?
Thanks, Senator Moody, for the question. Certainly the fee gap has always existed, which is to say average fees in nonprofit centers are lower in almost all cities compared to private centers. That was the result of the fees. So for-profit centers just on average charge more. That doesn't tell us anything about the cost. We didn't analyze the cost. We just analyzed the fees. Broadly speaking, what that might mean is that to buy an extra space in a for-profit center is going to cost more than buying a space in a nonprofit center. Now, this gap existed prior to the CWELC, the provincial implementation of the CWELC programs and the 50% reduction. That gap has widened even further as a result of the CWELC programs for a couple of reasons. Several of the gaps are quite large in the BC cities. One of the reasons for that is the expansion of $10 a day spaces that existed in all cities in a minority of cases. About 10% of centers were at $10 a day prior to the rapid expansion in the last year and a half. That rapid expansion has happened almost exclusively on the nonprofit side and has been heavily weighted towards the city of Vancouver, in large part because the majority of its spaces are nonprofit. And so you see a big expansion of $10 a day spaces in the nonprofit sector in Vancouver, which drives a big gap between for-profits that aren't participating in $10 a day and nonprofits that are. Broadly speaking as well, there is non-participation in these programs. So in most provinces, you don't have to participate in a fee reduction program. The centers that are not participating in fee reduction programs are more likely to be for-profit. Now, that's not to say that there aren't plenty of for-profits participating in fee reduction programs. There are, but for the programs that aren't as likely to participate, they're more likely to be for-profits. So in terms of the question of expansion, there's been relatively little thought, and this is something we looked at in our Childcare Deserts report, about public management of the location of new spaces. So unless we actually say we want more spaces in small towns and rural communities and certain underserved suburban areas, we won't get them there. If we say to providers, here's a load of money, go build a center where it's most convenient for you, centers will locate in big cities and they'll locate in downtowns because that's the pattern we already see because it's most convenient for them. Not only do they get access to higher density areas downtown, they also get access to commuters. People commute with children because there's potentially more spaces downtown than close to where they live in suburban areas. That's not how we manage public education. We don't locate schools where it's most convenient for the school. We locate schools close to where kids live. That's not how we have managed the childcare system, unfortunately. Now, there are some exceptions to that, but I think one of the big challenges is actually, and this is, one of the recommendations is having public management of where those centers go, attempting to keep those costs low, to contain costs, so a portion of what's being paid to build and run new centers isn't going to profits. There's very little optimization that can be done in a childcare center. There aren't sort of innovations. Your costs are quite set, right? You have staff costs, you have real estate costs, and those don't vary because they're regulated. So you can't sort of decrease the staff count because that's illegal in most cases. And so the only way you can squeeze a profit line in there is through higher fees. But if you can't charge higher fees because they're being regulated, you might potentially get them through lower wages or lower real estate costs. But again, there's a problem there, right? That profit has to come from someplace.
Thank you.
Thank you, Senator Moody. Senator Bury.